Today our topic is cardiac markers. Cardiac markers are enzymes or proteins which appear in our blood once our heart muscles suffer injury like myocardial infarction or angina or any kind of injury. It results in few markers appearing in the blood. And troponin is a contractile protein. In troponin, we have troponin T and we have troponin I. A person suffers a heart attack or myocardial infarction, it starts appearing after 4 to 6 hours of the MI, this troponin I. Then in 12 hours it reaches to its peak value and it persists to 3 to 10 days, and in 3 to 10 days it returns to normal. So this troponin I has highest sensitivity and specificity for myocardial infarction. Because of its high sensitivity and specificity, it is the best overall marker, this troponin I. We have creatine phosphokinase. Creatine phosphokinase, it also starts elevating after 4 to 8 hours of MI, and it reaches its peak values in 12 to 24 hours, and it returns to normal in 3 to 4 days. So it is useful for diagnosing the reinfarction, like if person suffered heart attack like 3 days before, but in 3 to 4 days it will return to its normal values, and if again after 3 to 4 days again person suffers from MI, so it will elevate again and it will reach its peak values in 12 to 24 hours. So this enzyme marker is important for diagnosing the reinfarction. Lactate dehydrogenase, we can remember it using L. Lactate dehydrogenase, it is a lazy enzyme, like it comes late and goes late. It means it takes more time than other enzymes to reach its peak values. Like its initial elevation starts after 6 to 8 hours, and then it reaches its peak values in 24 to 48 hours, and then it returns back to normal in 6 to 8 days. Like it takes almost complete 1 to 2 days to appear in blood, and then it persists in blood for good 6 to 8 days, and then it goes back to normal. So we can remember it like this, that it is a lazy enzyme, it comes late and goes late. Then we have myoglobin. It is basically a muscle protein. It is present in skeletal muscles or cardiac muscles or like this. So that is why it is not very much specific. It is less specific because it is not only present in cardiac cells, it is also present in skeletal muscle cells. So if there is even injury of skeletal muscle cells, myoglobin levels will be raised. It's a muscle protein, but it is not very specific. It is less specific, but it is very sensitive, and it starts elevating in 2 to 4 hours of myocardial infarction. Then a peak value occurs at 6 to 8 hours, and it returns to normal values in just 24 hours. So in only 20 in one day it completes its all cycle. Like it start appearing in the blood, it reaches its peak value, and within 24 hours it goes back to normal. So this myoglobin first come first goes. See the order of cardiac enzyme elevation. We have seen that myoglobin, it first comes and first goes. So at first the myoglobin appears in blood, then CKMB, then troponin I, and at last there's lazy enzyme LDH, lactate dehydrogenase. Some MCQ points, like if we have a scenario where a person has suffered MI attack, so and within first 6 hours he reached to the hospital, so our best initial test in first 6 hours would be ECG, right? And then in 1 to 2 hours we know that first protein or first cardiac marker to appear is myoglobin, although it is not very specific, but it is the first one to appear. So in 1 to 2 hours we would use myoglobin. Within 4 hours we can use CKMB. After 4 hours, troponin. The sensitive most is troponin T, and specific most is troponin I. So this was all about cardiac markers.